It is a field of zero mistake. They can even walk after 3 to 4 hours after the surgery. They have forgotten their knee have been replaced. I'm Dr. Teh Hak Lian, Orthopaedic Surgeon, specialised in joint replacement and trauma. Since young, it has been my interest or hobby to fix things. Orthopedic is a field that I can fix the broken pieces and unite into one. It is a paradigm shift that the surgeon moves from conventional to robotic, and not only restoring the mechanical alignment, we move towards functional alignment. In the past, everyone received a straight knee after a total knee replacement by conventional method. So I considered robotic total knee replacement as to redesign the knee and to restore the functionality of its origin. Auntie, morning. Okay, I want to see your knees. Patients have less pain. They feel their knee more natural. They can even walk after 3 to 4 hours after the surgery. And most of them are walking without crutches after 1 or 2 weeks. Sometimes my patient even tell me they have forgotten their knee have been replaced. So this shows the importance of giving back the patient natural feel of their knee. We need to listen to the patient. The most important thing is to understand every complaint that they make. Trust what the patient say. We need to find the best source of the pain to arrive at the correct diagnosis. There is no single hero that can save the entire universe. You need a teamwork. Even the Avengers need teamwork. It is a multidisciplinary approach for a successful surgery to ensure better outcome. Whether it is a medical or surgical field, it is a field of zero mistake. We need to get it right from the first time itself.